So, Dr. Cox, there are some patients who say they just don't want to be cracked. What does Cox Technique offer that might soothe them?
Well, that cavitation, that cracking called tribonucleation, is really the movement of these joints in the spine. When we move a spine, sometimes they emit a gas, which you can hear as a crack. Now, two things. Number one, many people don't like that feeling. They find it to be, for some reason, uncomfortable and negative. The other point is that as we age and these joints thin and these sacroiliac joints become somewhat arthritic, they don't move. You could not make them cavitate because they're degenerated to the point that they can't produce gas. That's why when we apply this technique with this spine on the instrument and we distract it and we open the joints and then place them into their normal range of motion, people find this very comforting, very soothing, and they don't have to undergo that cavitation or that cracking sound that many people object to and many people will not be able to do as they age. Thus, this technique is the answer for people who find it unpleasant or who can no longer cavitate or crack their spine.